My name is Okafor Chinyere. I'll be presenting on ethical challenges of international outbreaks, a case study of Ebola virus disease. Sorry, some of the slides that are not here, I will feed them up with my paperwork. Now, in summary, public health measures employed during international disease outbreaks pose ethical challenges. Outbreaks in developing countries are affected by weak health and economic systems. The Ebola virus disease outbreak of 2014 affected a few countries in Africa with potential regional and international dangers. October 2014, there were about 8,914 cases of Ebola virus disease and 4,407 deaths. The outbreak response consisted of isolation and restriction of free movement and liberty. This was in conflict with constitutionally protected rights of citizens and posed ethical questions. And the aim of this study was to identify and propose solutions to these ethical challenges of managing disease outbreaks. I will give a summary of an introduction. An infectious disease like Ebola virus can threaten the stability of a country or a region's government, its economy and social fabric. Ethics is concerned with distinguishing between good and evil in the world, between right and wrong human actions, and between virtuous and non-virtuous characteristics of people. It can also be defined as the rules of conduct recognized in respect to a particular class of human actions or a particular group or culture, despite the existence of ethics guidance in relation to specific disease. Like I was saying, despite the existence of ethics guidance in relation to specific disease like Ebola, comprehensive international and global public health ethics guidance related to epidemic outbreak is still lacking, especially in Africa. The response to any outbreak entails being prepared to limit individual rights and civil liberties in the interest of public health. International outbreaks have increased the social and economic inequalities within and between countries with these economic consequences. Now, what are the study questions? We are thinking of what are the ethical challenges that we encounter in these international outbreaks. One is challenges of isolation of patients and contacts, challenges of using new and untested vaccines and drugs, challenges of prevention of spread. The methods I used were I obtained information from a depth review of publications and reports on the recent Ebola virus disease. Publications from CDC and WHO, articles on Ebola virus disease outbreaks were also identified, and these included articles on ethical challenges encountered by healthcare workers and public officials. The results I saw were that ethical questions that arose during Ebola virus outbreak could be classified as social, medical, economic, and psychological. The medical issues included use of experimental drugs on patients involved, issues of who should be treated with scarce drugs, and lack of adequate resources and resultant exposure of healthcare workers to risk. Others were social and economic challenges, which included issues surrounding quarantine and isolation of patients and contacts, attendant loss of income, job losses, and stigmatization. Psychological and emotional challenges, which included emotional trauma of isolation, loss of self-esteem, and difficulty reintegrating the people into the society. The family members of patients also have psychological difficulty. The fear of contracting the disease was high, and they faced stigmatization. Spouses have a fear of long-term exposure to the disease even after the cure of their partner. Now, what were the solutions that I thought would be preferred? One, the solutions included there should be provided choices by the patients of where they wanted to be quarantined, whether they wanted to be quarantined at their homes or in government reserved areas. Measures for comprehensive loss of income of individuals to improve future compliance, like those who were not going to work, they should be able to be given some sum of income during the time of their non-come to the offices. measures to help integrate these people back into the society after the quarantine to reduce and avoid stigmatization. An invention of more vaccines and drugs should be taken seriously. The measures should be taken for restriction must be reasonable and effective, and no discrimination should be employed. The government should help provide diagnostic and supportive devices and also protective wears to help healthcare workers and management. And also critical need for capacity building and ethical review of public health research and practice, and increase public health awareness about the disease and its related risks will enable people to take steps at individual, family, workplace, and community level to prepare and respond to these epidemics. Now, conclusion and future steps we should take. Ethical gaps were observed in the management of the recent Ebola virus disease outbreak, and questions about human rights violations arose due to quarantine and stigmatization of cases and contacts. The use of experimental drugs in patients occurred and was regarded as an ethical violation. It is recommended that procedural framework should be established that will be used during similar epidemics in the future. Measures for restriction should be reasonable and effective and also devoid of discrimination. There is a need for capacity building in the area of ethical review of public health research and practice. Some limitations is we notice that social media platforms like WhatsApp, there was no censorship to what is being posted. So people post a lot of measures to avoid this Ebola virus, which were not ethically right. And also confidentiality was also wrong. Finally, national preparedness plans for the control of epidemics were highly needed. The references in this survey are the ones I was able to pick up from. Thank you very much.